tell us a little bit about what hospitals can expect in the next year or so in relation to hospital or healthcare reform?
I think for the most part, it will be gearing up for the implementation. CMS will be spending lots of time preparing, putting out how they might implement things like accountable care organizations and other demonstrations, whether it be bundled payment systems, value-based purchasing, lots of things that may be centered in the hospital. If I'm a hospital, I want to be working with my physicians and the hospitalists to ensure that we end up with the best possible reimbursement, that we reduce unnecessary readmissions, that we improve our quality indicators, etc. That way allowing the best results once CMS does implement these changes, that going forward that hospital is in the best situation possible.
What are some of the ways that hospitals can help their hospital stay on top of what's coming up in the future?
Well, discharge planning is one area which will be critical both to avoid readmissions but also to ensure that patients get the sort of quality care transitions that they're going to need to have which will impact value-based purchasing as well. And if they do bundling ultimately or accountable care organizations, these post-acute care transitions are going to be very important. And the hospitalist is well situated to ensure that the patient is treated not just well in the hospital but also with the appropriate follow-up care.
And finally, you talked a little bit about patient responsibilities and all of this too. What's the role, how can a hospitalist help inform the patients about their role in their treatment?
Well, I think some of the most important things is just to be clear about what's required of a patient and to let that patient know. Often a patient is stunned. They're in a hospital and they're in a very vulnerable situation. So one of the things that might happen is first just talking to a physician and having the physician be involved in what happens in terms of discharge is critical. But also working with family members and others who can help the patient be seen both while at the hospital and afterward to make sure that what's happening at home is appropriate. And sometimes it's just being clear and talking to someone other than the patient. And again, a hospitalist can make sure that these transitions do happen, watching and getting to know the patient while the patient's in the hospital, and making sure, most importantly, that a patient at least sees a physician, whether it's a hospitalist or a community physician, after they've been discharged from the hospital, as several, I think it's upwards of 50% of patients who are readmitted within 30 days haven't seen a physician. So it's a remarkable number and quite surprising, and something that we should be able to change pretty easily, and hospitalists in particular should be able to do.
And this isn't something that's particularly new to healthcare reform. This is something that's going on right now, right?
Absolutely. You don't have to wait for healthcare reform to be implemented to put these things into place, and that's one thing that I would hope hospitalists are doing already. And for those hospitals that don't have those programs, well, perhaps they need to get them.
Great. Well, thank you very much for your time.
Not at all.
Thanks for coming to
Sure.
HM10.
Glad to be here.
Thanks.